everyone, and welcome to our special live session from Policybazaar.ae. We've just finished celebrating the season of love, and we are reminded that caring for ourselves and our loved ones is at the heart of every relationship. My name is Priya Jethani. I'm representing Policybazaar.ae, and I'm here to lead this very amazing, interactive, and insightful session on mental health. Today, we are focusing on mental health awareness and exploring how feeling secure financially and emotionally contributes to our peace of mind. At policybazaar.ae, we believe that true love includes protecting what matters most. Whether it's helping you pick the right health insurance plan, or offering practical insights into managing stress, we are all about making life simpler and worry free. And that's why we are thrilled to be joined by a special guest who's an expert in mental illness. Please welcome Dr. Nidhi Kumar, Specialist Psychiatry, Aster Clinic's Almutina, Dera. Welcome, Doctor.
Thank you very much. Good evening. Uh, I must say I'm thankful to you for spreading the awareness about mental health in the community. Thank you very much.
Well, absolutely. Our mental well being directly affects our relationships, right? Our day to day happiness, and it also affects how we plan our future. So that's exactly why we are here to explore how our viewers can reduce worries and how they can feel more at peace. So, for everyone tuning in, get ready for some practical advice on how to manage stress. We'll give you some tips on self care, and we'll also show you how you can be more at peace in your mind. So let's dive in, Doctor. Many of our viewers are working professionals who are juggling in their daily lives with multiple responsibilities. That includes work, family life, health, finances, etc. So tell us, Doctor, in your opinion, what are the most common mental health issues that you have seen in the world and in this region in the UAE?
Yeah, common mental illnesses or mental disturbances which are prevailing in the world and in UAE, number one is depression, anxiety, stress related disorders, substance abuse, alcoholism,
Hmm.
and not to forget about schizophrenia and other psychosis. These are the five marker illnesses. I have
Mhm.
narrated them in the order of frequency of prevalence, or more from top to bottom.
Right.
But there is one etiology. Etiology means the cause of all the mental disturbances, and that is stress, which
Right.
unfortunately is rising um, from day by day. It is increasing and inevitable.
True, true, exactly. I think stress is something no matter how much we try to avoid, it just comes in from somewhere or the other, and it gets very, very difficult to block it out. So in this kind of a scenario, Doctor, what is your advice for practicing self-care in a busy world? And what are your go-to strategies for managing stress when life feels overwhelming?
Well, if you ask me very, very frankly, I'm not able to manage stress. Nobody can manage stress. Humans, animals, nobody can manage stress. Stress is a fight or flight reaction. You know, what is exactly a stress in simple format if I explain to you? If S is equal to P more than R, P is the
Hmm.
pressure on you, R is your own resources,
Hmm.
right? And S is the stress.
Yes.
Certain amount of stress is actually required in the life, that is called as eustress or something good stress. Have you
Yeah.
noticed that in the last overs of the match, there are maximum number of runs scored? You must have noticed that. That is,
Yes.
you see, good stress. But if the stress becomes overwhelmed or more than two standard deviations, if I can get that, then it is a distress, not a
Hmm.
eustress. Then it
True.
becomes, and the two main types of stress is the acute stress reaction and
Hmm.
something called as chronic stress. Chronic stress, which is going for months, years, sometimes decades also,
Yeah.
leads to mood disorders. Acute stress leads to acute anxiety related situations, which often we come across in our psychiatry OPD.
Right.
So that is stress. But the bottom line is we cannot avoid stress. Huh?
Hmm.
I can deal with stress. We have some ways of dealing or reducing the stress. But
Hmm.
if you ask me, stress can be totally removed? No, not at all. It was there
Hmm.
before also. It is increasing sturdily now.
Hmm. Hmm. Right. So, in that case, Doctor, let's come to one aspect, which is the workplace stress. That is something which a lot of us deal with on a day to day basis because we are trying to kind of create a work life balance. And we also want to meet our professional expectations, but we also want that balance, and we want to live our lives as well. And a lot of stress comes along with that. So, what is your advice on managing that?
You see, there are two worlds in which we all live today. One is the occupational sphere, other is the domestic sphere. With the
Hmm.
coming of internet, mobiles, and social media, these two worlds are getting dissolved. So most of us carry work at home.
Hmm.
Most of us are not able to manage this
Hmm.
fine balance.
Hmm.
I would like to request all of you to just focus on one thought, that you all are replaceable at work. You all are replaceable at work, but you all are irreplaceable at home in family. If you are devoting 8 hours in your office, you must spend at least half of it quality time with your wife, with your children, with your parents. That is, I know it is quite difficult to have an equal balance between both of them. But then, first, let me explain how you can reduce the work related balance,
Yeah.
work related stress. You need to jot it down, you need to write it down, how many things are in our hand, what are the priorities. Set out your targets. What are your priorities? One, two, three, four, five. Avoid doing multitasking. If you open a lot of files in a computer, it gets hanged, right? Which is commonly happening. The
Yeah.
other thing which is in common in psychology, we in psychiatry we call as brain dumping. You just write down your emotions, take a break for 1 minute, write down all the emotions, all the problems, write it down on a paper, then
Yeah.
prioritize it one by
Hmm.
one. Try
Hmm.
to do that. Focus on your breathing for a while. Take a deep breath till your abdomen distends.
Hmm.
It stimulates the parasympathetic system of
Hmm.
of the body, of the
Hmm.
CNS, which
Hmm.
relaxes your heart, your blood pressure. Something's related to pranayama. Focus on your breathing. Get out of your cabin for a while. Stroll. Talk to your colleagues. Have a cup of tea. Take regular breaks, say about every 40 minutes, 50 minutes of sitting constantly. You must take a break.
True.
Reason being, there is a study recently which says sitting is equally or almost comparably as harmful as smoking. Sitting increases the cortisol levels, reduces the blood flow from the lower limb, can cause pulmonary thromboembolism, heart related illnesses, diabetes, and all these things. Now, coming to the domestic spheres of life, unfortunately, we are moving. We have moved already from joint family concept to nuclear and now subnuclear family concept.
Yeah.
The benefit which was there in the joint family was that I remember we when we used to be kids, we used to be father used to scold me sometimes. We used to run for our paternal uncle. We call it Tayaji, Chachaji for help. And they used to, you see, when help came for rescue, we used to share a lot of our clothes. We had only one toilet. All members were
They're
using
using
the
the same.
same. We used to yeah, so all our happiness was divided, all our sorrows were divided. So the nuclear concept of the family has earned this trust in the domestic sphere. There are two family members. Unfortunately, both are working. Husband is working, wife also working. Both are running towards their targets. Unfortunately, parents are also now not able to be get afforded
Yeah,
in the current scenario.
true.
So, but then there are good things about it if you can spend your life, if good quality time with your wife, with your children. Believe me, you have a lot to learn from your children. I learn a lot from my daughters. They are tech savvy. They teach me many things. I'm learning these days cooking from my wife, and believe me, it's quite de-stressing. I mean,
Yes.
it is. So keep learning throughout your life. That is itself a big de-stressor. uh, my wife will have started a new venture in her life, and has started you see, designing clothes. I am learning music. I go
Okay.
home, I sing
Amazing.
sometimes. So you see, the other aspect, the domestic frame of your life should be
Hmm.
entirely different. It should be
Yeah,
entirely different. You should not intermingle both the things together. I mean,
absolutely.
to be blunt, I would like to say, be little selfish towards yourself.
Yeah.
Okay? Yeah.
Yeah, I think very well explained, doctor, when you said that at work, no matter what, you are replaceable. So today, if you are only you can do this, tomorrow there will be someone that will be able to do that job for you. But at home, nobody can replace you with your family, and
Absolutely.
that being around the family is what is the most de-stressing, and activities that you do with them are great stress busters, like you mentioned, cooking and music and spending time with your loved ones.
Absolutely, absolutely. I must say, you are a princess for your father.
Yeah.
You are a queen for your husband if you are married, and for your father. I'm a superhero for my daughters. So
Yeah,
you see, that is a totally irrepressible role. You are not replaceable at your home. So
true.
give importance to your family. It
Yeah.
is a big stress buster.
Yeah, as you rightly said, I'm a queen for my husband. I make him cook also sometimes, but that is not because he's interested in it. I just want him to do it.
You,
Okay, so Doctor, next question I wanted to ask you is that a lot of us feel, we come to a level without realizing that we burn ourselves out. We feel that we are exhausted, and there's a burnout that's happening, and we can't think or come up with anything new, neither at work nor be our normal selves at home. So, how can one understand these early signs of a burnout, and what can we do to address it before it gets worse?
yeah, burnout is a term which is accepted and integrated by WHO in 2019. It's a very recent term. Burnout is a syndrome. We are we pick up some signs and symptoms. I must share with you: irritability, easy irritability, headaches, sleeplessness,
True.
mood disturbances, digestion related issues, some palpitation, increase in the heart rate,
Hmm.
okay, frequent micturition, loss of libido or sexual drive, loss of interest and motivation,
True.
loss of belongingness to the company,
Hmm.
and ultimately the person becomes aloof and withdrawn in himself or herself. These are the signs of and one must I from forgetting one, alcoholism or
Yes.
increasing indulgence in substance like cigarettes, like drugs. These are all reflections of a burnout syndrome.
Yeah.
If you do not treat in time, the person lands up in frank depression, and
Yeah.
leads to often untoward events in life like suicide or a deliberate self harm.
True.
Okay.
Right. Doctor, I've already started receiving questions from our audiences, but I would just like to tell our viewers that just hold on for a few minutes. There are some questions that I have on my list and a little game that I want to do with Doctor. And then we will be, of course, answering all the questions that you are sending us. So be patient. Doctor, tell us about the importance of sleep. We sometimes really, I think, sleep is very underrated, and we feel that a few hours of sleep is enough as long as it gets us going throughout the day. But we sleep can play a very vital role in our health and our physical and mental well-being. So please throw some light on that.
You see, I'll give you a small example of your mobile phone. You need to recharge it. I'm sure
Yeah.
about it. You must be recharging it. So just like that, our brain is a supercomputer. It's got software inside. The neurons, they interact with each other with chemicals. Those are called neurochemicals, serotonin, dopamine.
Yeah.
So, to recharge the brain, there is only one way: sleep. Sleep of at least 6 to 8 hours uninterrupted is
Yes.
necessary for any adult human being. Gradually, after 65 years of age, the sleep gets declined. Uh, Elderly people, for 5.5 to 6 hours of sleep is enough for them. On
Yeah.
the other end of the spectrum, young children sleep up to 10 hours in a day. I mean toddlers, I'm saying. And newborn, they sleep up to 20, 12 hours. Sleep is actually one more important role of sleep is it gets disturbed as the first sign. It is the first sign of any mental disturbance, any mental stress. The sleep firstly goes away. So we often ask in our OPD, I ask the patients, is how's the sleep?
Hmm.
Anxious people says, there is a difficulty in entering into sleep. Depressed person says, I get up in the middle of the night. That is called
Yes.
early morning awakenings. They get up in the middle of night and then they cannot go back to sleep.
Yeah.
So sleep, actually, if in this modern world, if you ask me, sleep is becoming a luxury for super busy human beings.
True.
But at the other hand, I would like to stress that should not be neglected. There's
Hmm.
something called sleep hygiene, where there are ways of improving your sleep, like
Hmm.
take a warm water bath, shower before sleep, wear light clothes, avoid mobile, avoid internet 1 hour before sleep, read a book, listen to some light music before sleep. Do not do vigorous exercise in the evenings or more in the nights. So these are the ways of improving your sleep. Okay, and the
Yeah.
importance of sleep, as I just told you.
Yeah, I think these are some great tips, Doctor. In fact, I am probably a victim of this, someone who has actually suffered, less sleep and disturbed sleep, and sometimes waking up in the middle of the night and not being able to go back to sleep. Everything that you just mentioned, I've been a patient or a sleep patient, if you want to call it that. But as one of the tips I tried to use was to read a book. And I'm not even so much of a reader since childhood, but I have tried to inculcate that habit purposely to keep myself away from my screen, because I'm honestly working on my screen all day long without even realizing how many hours I am spending, and the light from the screen, whether it's my iPad or my laptop or my phone. So it's either of those which are constantly on in front of me. So I try to push it away in the night, and 1 hour before I sleep, I'm just forcing myself to read, and that has kind of now become a habit, and I look forward to reading before I sleep. So I think that
That's a
really
very
helps.
nice, yeah, that's a very nice lifestyle modification,
Yeah,
because the light coming from the fluorescent screen, they reduces the melatonin production in the brain, and that reverses the circadian rhythm.
true.
So you did a good thing of inculcating habit of reading books. Very nice.
Yeah, yeah. Doctor, very quickly before we move on to our game, if you could demonstrate an activity that we can all do to manage our stress on a daily basis, some daily habits, whether it's while sitting at a work desk, or we are sitting in our car in a parking lot, or stuck in traffic, or just sitting at home, what are these few things that we can do?
Like, I can tell you, not exactly demonstrate. Like, first and the foremost is I just started doing it on myself, and felt quite relaxed.
Mm-hmm.
Deep breathing. You will be surprised that in the day to day life, we are sometimes using 25% of the breathing. Oh, deep breathing means take a deep breath, feel your abdomen going out, and then release it.
True.
Do it 10 to 12 times in 1 minute, just 1 minute. Just
Yeah.
1 minute of doing it reduces your pulse rate, reduces
Wow.
your blood pressure, your brain fogging goes away. Believe it, if you start doing it, it may be sounding very silly, but if you do it. Second thing is meditation or focusing on your breath going in and going out. Again, this is very silly in for any person, but if you ask me, it is true. In a way, it clears your mind.
Yeah.
Thirdly, if you are stuck up in a traffic, listen to music,
Music.
any light music. Music is in itself a therapy, which we
Yes.
all have forgotten. Okay, so then, as I said, after every 30 minutes or 40 minutes of sitting constantly, stretch
Stand.
your legs, stretch your body, stretch your neck, hold your neck tightly and arms tightly, then releases it slowly. That
Yeah.
is something similar to Jacobson's progressive relaxation in
Hmm.
psychiatry, JPMR
Hmm.
we say.
Hmm.
So you should do that. You everybody can do it in his or her office. Stretch
Yeah.
a bit. There are few companies which have started keeping treadmills and few health equipments in the company itself,
Yes.
because
Yes.
the more relaxed the employee, the more productive the employee. The
Absolutely.
Yeah, I believe in that.
100%. All right, Doctor, now before we take questions from the audience, there's a quick myth versus fact game that I want to play with you. I'm going to give you a statement. You tell us whether it's a myth or a fact, and you elaborate and explain why. Are you ready?
Okay, okay, okay. Yeah,
Okay.
yeah. I'll try my best.
Okay. The first one is talking about mental health openly can reduce stigma.
Yeah, yeah, Bill, absolutely correct. You see, the first thing is we are not open to mental health and illnesses.
Yeah.
I honor and salute everyone who is coming inside my chamber for consultation.
Yeah.
He or she is a brave man or woman. You see, asking for a help is not a sign of weakness. It
Yeah.
is a sign of bravery. Mental health, if you are not discussing, if you're not talking, you are letting an illness grow inside you. So
Yeah.
talking to a help about mental health reduces stigma. It's perfect. correct statement, 100% correct.
Great. Next one. You can't manage anxiety without medication. Is it a myth or a fact?
Uh, you can manage anxiety to certain extent. Not
Okay.
every anxious person or not every anxiety case requires medication. I would
Okay.
say 15 to 20% only of the cases they actually require medications. They are called as anxiolytics or SSRIs, selective serotonin reuptake inhibitors. But
Hmm.
mild to moderate uh, can be reduced by lifestyle modifications, meditation, yoga, regular exercise, and cognitive behavioral therapy by the therapists. So not exactly 100% are in the need of medication.
Medication. Got it. Okay, last one. Having the right health insurance has no impact on mental well being.
No, 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 no. I must say a comprehensive or a premium or the the health insurance should be taken because we do not know about our mental health, about our the mental illness when it will strike anybody. Anybody, if we
Correct.
have a good health insurance plan, a person is actually relaxed and he or she knows that tomorrow if I fell ill, mentally ill, somebody is there to take me, because believe me, mental illness is a very expensive illness to treat.
Yeah.
There are very few psychiatrists. I was reading the literature in UAE. There are just 1.25 per lakh. So the illness treatment is very, very costly. So I must request all my patients to take the premium one insurance, the best insurance, which
Yeah.
covers mental illnesses and mental health.
Health. Exactly. And at this point, I would also like to tell our viewers that whether it is about a health insurance plan or it is about a term plan, and there are different kinds that Policybazaar.ae offers, and you can see which one suits you the best. When you have a plan like this, you are kind of at peace in the sense that tomorrow, no matter what kind of an illness you may have to deal with, you know that you are sorted and you are secured. If the need arises, then the term plan or your health insurance plan is going to take care of what you are suffering with, whether it's a physical or a mental illness. So I think that really
Exactly.
helps to reduce a lot of stress, even financially and emotionally, on a person.
Exactly, exactly. A lot of my patients come from cardiology. A lot of my patients come from gastroenterology, and then
True.
they come and then they suffer because unfortunately their insurance plan does not cover psychiatry.
Yeah.
So I would request all of you to include your insurance in mental health also in your insurance plan.
True.
With the increase in the stress and increase in mental illnesses nowadays.
Great. All right, doctor. So now the questions have started coming in from the audience. So let me quickly take on our first one. Uh, this one says, what small daily habits can improve mental health?
Come on, pardon me. What?
What
I couldn't get the question.
daily habits can improve mental health?
Okay, okay. What daily habits? Okay, okay, okay. I will tell you about it. Very good question because exercise. 150 minutes of weekly exercise, or you can say
Hmm.
3 to 4 days of 30 minutes of workout daily is
Hmm.
important. Number one. Number two is healthy, balanced diet. We from Indian subcontinent, we are eating more of carbohydrates than the protein and fat.
Yeah.
So a balanced diet, sprouts, for example, they have a lot of antioxidants, which reduces the cortisol levels and improves the
Correct.
serotonin levels. Banana, for example, a very cheap fruit, has got a lot of tryptophan,
Yeah.
which which helps in producing serotonin and improves lifts up your mood.
Yeah.
Okay, so this one, and inculcate a hobby.
Yeah.
I would like you to stress again and again, be a child. In your, there is a child in every human being. You remember your college days, you were pursuing many of your hobbies. Go back to them.
Hmm.
If you are a good painter, start painting. Start taking some time out of your daily life. Start sketching on your table itself. No, I don't care. Okay, so if you are a musician, please pursue the habit of your of hobby of your. If you are good, gardening is a good hobby. Cooking is a good hobby. Anything which involves you totally
Yeah.
relaxes your mind. Okay,
Yeah. It's
so
therapeutic for sure.
and the third is a very important thing: stay away from false coping mechanisms like alcohol gives you instant relief of tension, but it is highly addictive. It
Yes.
destroys your neurons. It hits you from scalp to toe. It destroys your heart muscles. It causes myopathy, something called as dilated cardiac myopathy, and it causes cirrhosis of liver. Everybody knows that. It
Yes.
takes away the sexual drive. It further causes intermarital disharmony.
Yeah.
Then it destroys the sleep pattern. So
Yeah.
alcohol, stay away from alcohol. Same is
Yeah.
true with cigarettes, same is true with cocaine, same is true with any substance abuse. I would say these short term gains are not good at all. Instead of that, you have a dietary modification, lifestyle modification, as we just discussed before.
Understood. Right, doctor. Next question is: what are some of the strategies for overcoming the fear of failure that often contributes to anxiety?
Fear of failure. Well, if you, I would just like to remember Bhagavad Gita. You see, Bhagavad Gita says you stay in Vartaman. Vartaman means the present.
Present.
Okay, yesterday is an imagination,
Yeah.
tomorrow again is an imagination. Okay, today, right now, is what is in our control. So anticipatory anxiety will go away, or at least your mind will learn to stay away from anticipatory anxiety.
Yeah.
Another thing is, I would like to say, not everything is important in life. Not every call is important. Not every mail is important. Start, don't start running in a rat race. जो प्राप्त है जीवन में वो पर्याप्त है. If you, my viewers, can understand Hindi, which is available to us, is more than enough.
Yeah.
70, if you're able to earn your clothing, if you are able to earn two times of meals, you are, believe me, more than 70% of human being existing on earth today. So have faith and give thanks to the God Almighty, whoever is. And this with this kind of feeling and start of the day, I am sure your anticipatory anxiety will turn down, will go down. You are the
Yeah.
best. You are the best in that role because God has made just one of you. There is no other DNA. Okay, there is
Correct.
no other person better than you during that moment.
Yeah.
So believe in yourself. Believe, if you start believing in yourself and Almighty, the anxiety will disappear. That's the teaching of most of the religions.
Yeah.
Okay.
Great. Doctor, another question is: can overeating be a sign of stress and anxiety?
Overeating and eating disorders, yes, in certain depressions, especially in women and old age,
Hmm.
called as atypical depression, they leads to
Right.
overeating, oversleeping, fatigue all the time. In overeating, I would like to further explain eating sugars,
Yeah.
eating pure carbohydrates, they are sign that is one of the sign of underlying depression, because a
Yeah.
lot of patients of depression, they gain weight, a lot of weight, because they go on binge eating, especially in the midnight. They
Yeah.
get up and they eat, because sugar gives them an instant satiety, so that's why they do that.
Yeah. Right. Doctor, one more question that I've just received is about someone who is asking about major milestones. If they have major milestones coming up at work or at the personal front, they start feeling very, very overwhelmed. So, how to navigate through those days?
your voice your voice is cracking, it's not clear. Can you
Can you
repeat the
hear me now? Is
question?
it better? Hello?
I'm sorry, I could not. Yeah, yeah. Now, can you repeat it?
Is it better? Okay, I'll just repeat the question.
Yeah.
Okay. So someone has asked that they feel overwhelmed when there are major milestones coming up at work or at the personal front. So how should they navigate through those days?
Major milestones means, what is major? First of all, you have to define major. Is it major for the company, or is it major for you? You have to sort it out. If it is of something big, you need to cut it into pieces.
Yeah.
Take one task, develop one skill in a day, plan your goal before a major event. If,
Hmm.
for example, if you are to present something, prepare it in advance.
Yeah.
That will reduce the anxiety at the 11th hour.
True.
Okay. And some life events are considered as major life events of our life, in which we cannot escape the stress. Believe me, some of the life events means it's not related to occupation or profession. Number one is getting married is one life event. It is a big stress because it brings responsibilities. Losing a parent is a big stress. Getting a job is a big stress. Blessed with a son or a daughter is a big stress, because mind takes it as a stress. Good
Yes.
or bad is another thing. Okay, for mind it is an event. Now, if it depends on you how much weightage you want to give to a
Yeah.
mega event, for any event, for uh, any professional goal.
Yeah.
Believe me, I just give 30% to my occupational, and now giving most of the preference and the goals to my family and my children. So one has to prioritize the things.
Yeah.
As one grow old in the life, like 30s 40s, one should be more fragile and more sensitive towards the mental health. Start focusing more towards your family life than your occupational life, because the mind and your body is not that equipped to handle that much of stress.
Yeah.
So prioritize, prepare. That is my tips. I'm not covering the complete thing, but it's my small tips.
Great. One very interesting question has come across. This is, how can I support a colleague or a friend who seems to be struggling with mental health issues?
Okay, this is quite important also,
Yes.
because you see, first and foremost thing is, if you notice any change in an individual, any change in the personality of an individual, for example, your very close friend is not the same.
Yeah.
You can observe that wife can notice change in the husband, and vice versa. If you
Yeah.
notice some change in the personality of an individual, he becomes more irritable, not in touch with you while talking, losing concentration, losing focus.
Yeah.
lack of sleep, increasing indulgence into alcohol. If
Yeah.
you see these kind of changes from temperament to the behavioral one, is easily picking up fights, getting involved in legal hassles for small issues, becoming more impulsive. These are the changes. If you pick up these changes, you must suspect some underlying mental illness. Sometimes it could be a major mental illness like major depression.
Yeah.
It can be alcohol dependence syndrome. It can be plain anxiety.
Yeah.
But do not leave the individual in isolation. Try to take a medical help. Try to uh, let the individual talk, ventilate out. It is possible that the individual might be having some internal conflict in him or her, that he may ventilate out to you as a friend.
True.
Some certain individuals, I sometimes they have suicidal ideas inside them. So asking an individual directly, if you feel so, look, you are looking quite depressed, do you feel like
Look.
ending your life anytime in your life?
Hmm.
And
Hmm.
believe me, the individual will be more happy, more relieved to
Yeah.
answer this question.
Yeah.
Okay, so if you come across with any such information, please take the individual to the mental health worker or a psychiatrist or a counselor, or at least to a general practitioner.
Yeah.
Okay, don't leave it, because that's the best help you can do to your friend or your
Absolutely.
relative.
Yeah, yeah, 100%. I think that's a great tip, doctor. And I think we need to look around for watch out for our friends and close ones if they are dealing with something. And if we notice a change in their behavior, as you mentioned, we need to reach out to them and ask them questions that then once when we probe them to answer, they will be willing to share, and then we can get them the professional help that is needed.
Exactly.
Right, Doctor, I'm going to end this session soon, but there's one more question which I had on my mind, which I think you can answer. It's about when people want, when should somebody think that they need to approach a professional help or a mental health expert? Can you give us some kind of examples? Because there may be somebody out there who's dealing with anxiety or stress to a level where they don't think that reaching out for professional help is important, or they don't, or they think it's a taboo and people might think they are crazy. So when should they approach?
You see, it's okay to be not okay, right? You are nobody to decide whom to approach. Approach to a doctor, first of all. Like patients, they come to me sometimes directly, sometimes they come to me through some other doctor or my colleague.
Yeah.
20% of my patients, they come from cardiology,
Yeah.
cardiologist. An equal number of patients come to me from gastroenterology. Like anxiety can present as sudden increase in heartbeat. Patient may feel like having a heart attack.
Yeah.
So first of all, you approach to a general practitioner, because all general practitioners are trained in baseline psychiatry to pick
Yeah.
up signs and symptoms of a mental illness. So
Yeah.
first, your job is not to directly to go to a psychiatrist, but yes, of course, anybody can come in. If one is sure of a mental illness, anybody can come in, because I'm a doctor first. I'm a psychiatrist later. I did my MD later. So if anybody is feeling mentally disturbed, emotionally fragile, let's talk. Do not feel hesitant, because I again repeat the same thing. Only brave people come to a psychiatrist, come for the professional help.
True.
It's a myth that the weak people ask for help. It's a myth,
Yeah.
entirely a myth.
Yeah.
Only brave people who are not bothered about society, who are not bothered about the stigma, they come for the right help. They come for the mental health professional. So don't feel hesitate. Don't hesitate. Let's talk.
Yeah.
Okay.
And I think it's important for people to also understand that sometimes you may be really willing to talk and share, but because there are people around you who you assume might judge you because they are close to you, they're part of your family or in your friends or your work group, and you cannot really share, you may want to go to a professional who may be neutral in their approach, who may be willing to listen to you, who will not judge you and will
जी,
give you different perspectives.
एग्जैक्टली डोंट थिंक व्हाट अदर्स आर थिंकिंग. अगर हम ये सोचेंगे कि लोग क्या सोचेंगे, तो फिर हम क्या सोचेंगे या वो
Absolutely.
क्या सोचेंगे,
हम क्या
है ना?
करेंगे?
उनको उनको सोचने दीजिए ना, जो वो सोच रहे हैं उनको
Yeah,
सोचने दीजिए. डोंट बी, आई मीन, आपको, अगेन आई वुड लाइक टू से, बी सेल्फिश
yeah, yeah.
in your mental health. When it comes into, when it comes to your mental health, be selfish.
True.
Let's talk. Don't bother about anybody. Be brave, and don't bother about that taboo stigma. Don't feel
Correct.
hesitated. Okay,
Absolutely.
psychiatrist is any other specialist. We are just any other doctor. We are not doing black magic. We are not doing something magical. We are treating patient with psychotherapy, with cognitive behavioral therapy, and
Yeah,
pharmacological interventions. So we are
yeah,
doctors.
yeah, yeah.
Okay.
Just like there are doctors for your body, there are doctors for your mind,
Exactly.
and it's
Exactly.
okay to approach one.
Exactly. Exactly.
Right.
That's the
Doctor,
message.
that was very, very insightful. Thank you so much for sharing these valuable insights and strategies and reminding us that securing our future emotionally and financially can truly help us to embrace life with less worry. I also
Thank
want to tell our viewers that now the new age health insurance also covers your mental health checkups and sessions, and you can check this on Policybazaar.ae. So please go and check out the new age plans, and whatever covers the mental health, you're free to explore and take the one that suits you the best. Remember, love isn't about just romantic gestures. It's also about protecting and caring for yourself and people around you, people that you love and cherish. Whether you're choosing a solid insurance plan, seeking the right investment options, or simply taking a moment to breathe, you're taking a step towards a more peaceful mind. So, for the right health, life, or car insurance plans, you can always visit Policybazaar.ae. And we will, of course, we are here to help you make informed choices and to live a happy and healthy and a secured life. And thank you so much for tuning in to this session. I think it was extremely insightful, and we'll be coming back with more and more. And we'll give you more tips on securing in your life and your future. So, stay safe, stay mindful, and remember, life is in the care. So thank you so much,
you.
Dr. Nidhi. It was wonderful talking to
Thank you
you.
very much. Thank you. Same here.
Thank you.